In the name of Allah, the most merciful and the most gracious. Students, we are doing chapter number 16, support and movement, and today's topic is bone fractures and bone repair. So, first of all, a fracture is a term that is generally used for a broken bone. These fractures may result in two different ages. It may occur during the youth or when a person is young. So, the fractures usually result from some trauma that may twist or break the bones during some sports activity or in some automobile accidents, or the person may fall, which will result into the broken bones. And during the old age, when the bones have become already thin and weak, so the fracture can result more frequently. Now the common types of fractures are discussed here. First is simple or closed fracture. Second is compound fracture or an open fracture. And third is called the complicated fracture. So we will talk about them one by one. A simple fracture has been shown in the diagram. It is the type of fracture in which only the bone has been damaged or the bone is broken down, but the skin has been intact or there is no damage to the skin. These fractures may occur at the bones like to the humerus or some tibia or fibula from the shaft region, or at some other region, but there is no damage to the skin. Second type is called compound fracture or an open fracture. In this type of fracture, the skin has been damaged and it has been affected, resulting or forming the wounds. You can see in the diagram, the broken bone has come out of the skin. The third type, as its name indicates, is a complicated one. In this type of fracture, the adjacent organs of the bones may also get damaged. It may cause damage to the blood vessels or nerves or other internal organs. Now, when the bone has been broken, it will repair itself either by the surgeons or by naturally. If there is no need of the alignment of the bone, it will start repairing itself by the natural process. But if the bone realignment has not been done yet, the surgeon or a professional will realign the bone to its original position, and then it will start repairing itself. And the repair process occurs in 4 major steps. First is called hematoma formation. Second is called callus formation. Third is called bony callus formation. And finally, the remodeling of the broken bone will occur. Now in the diagram, all the 4 steps have been shown very clearly. The first process, that is called hematoma formation, will result when the blood vessels in the bone and in the surrounding regions has been torn out, which resulted into the hemorrhage. So as a result of this, A mass of the clotted blood will form at the fracture site that you can see in first diagram, where a red clotted mass of blood has been started forming on the fracture site. Soon after, the bone cell deprived of food because the veins or the blood vessels has been torn out also, so the region will become deprived of food as there will be no blood supply. The bone will begin to die and the tissue at the fracture site becomes swollen, which results into a very painful condition, and it also becomes inflamed. These clots are removed by the bone itself. This process will be done by the reduction. Reduction is basically of two types. One is close reduction and the other is open reduction. This is reduction term is the re-establishment of the bone to its original form and structure. Second is the soft callus formation or the fibrocartilaginous callus formation, which occurs in 3 to 4 weeks. Now at the site of the fracture, the capillaries start growing into the hematoma and the phagocytic cells invade the area and they will clear up the cellular debris from the broken site. The fracture, it may also rupture the periosteum, which is the layer of the bone, and it stimulates the production and release of the numerous osteoblasts. Osteoblasts are the bone maturing cells. The osteoblasts, in conjunction with the fibrocartilage, forms the cells and secrete a porous mass of bone and cartilage called the cartilaginous callus, which will start surrounding the broken area. This callus, that is also known as the soft callus, will replaces the original blood clot and holds ends of the bones together. In this step, basically, the repair process has begun. Now the fibroblasts and osteoblasts will migrate to the site of the fracture and they will start to construct the bone. So in this step, basically, three processes has occur: the formation of the blood vessels, clearing up of the debris, and the fibroblasts and osteoblasts and its functions. In the third step, the bony callus formation or the callus ossification will occur. Osteoblasts and osteoclasts continue to migrate inward. It will multiply rapidly and gradually convert the soft callus into the bony callus. This process of bone formation begins after 3 to 4 weeks of injury and it continues until a firm bony union is formed. Now the union of the bone is of two types. It may reunite or it may not reunite, and if the reunion has not occurred properly, this is called malunion. or the bones may not join or unite again. This is called non-union. It will start occurring after 2 to 3 months. Osteoclasts break down the cartilage while the osteoblasts replace it with the bone. In the fourth step, the bone will start remodeling process by the excess deposition of the mineral ions. It takes place when a compact bone is formed in which the cells called osteons from both sides break and extend across the fracture line to connect the bone. Usually more bone is produced at the site of healing fracture than needed to replace the damaged tissue. Now, the osteoclasts, which are the bone destroying cells, eventually remove the excess debris from the site of the bone fracture, and final result of the repair of the bone will occur in which the bone shaped very much like the original bone. The final structure of the remodeled area resembles that of the original unbroken bony region because of the same set of mechanical stimuli and the information that was stored already into the chromosomal set. Now we will talk about the injuries to the joints. Sudden torsion to the joint that can be harmful. It results into the dislocation of the joints, and this occurs when the ends of the bones are formed from their formal position or from their normal position. Effects: a severe dislocation can cause tearing of the muscles, ligaments, or the tendons that were supporting the joint previously. The symptoms and causes of the injuries to the joints are: the symptoms may include swelling, intense pain, immobility of the affected joint, and the most common causes are a blow, fall, or other trauma to the joint, which results into the dislocation of the joints. Some diseases, such as the defective ligaments or the rheumatoid arthritis, can also cause the joint dislocation. Now, this can be cured usually by a successful reduction process into its normal position by a trained medical professional, and the other means are the surgery, which can be needed to repair or tighten up the stretched ligaments. Second type is the sprain, which occurs by an injury to the ligament. Now, commonly the sprain may occurs at the ligaments of the ankles, knees, and the wrist. And the common causes of sprain are: the ligaments can be injured by being stretched too far from their original position. and the cures are generally the rest is suggested, or it may or the icing process or the physical therapy can help it. Dressings, bandages, or egg wraps should be used to immobilize the sprain and provide support. Now, there are some first aid treatments which are done for the disorders of the skeleton. So, first of all, the patient needs to take rest. There should be no mobilization, means they should not move. The ice packs or the cold packs should be applied on the area to the affected part to reduce swelling. The victim should take proper rest, and the position of comfort should kept in mind. These dislocations involves the hip, ankle and leg joints, and compound fractures require ambulance to transport the victim. Proper care and prompt first aid increases the chances of complete recovery. Thank you so much.